Well, as you know, as we've stressed all along with NAP5, it's the methodology stresses it. It's very much about reported awareness. It's what patients were reporting. So the incidence, the overarching incidence that was quoted, the number of cases retrieved was all based on patient reports. We were satisfied that we were robust in the capture of those reports over that calendar year. I think with the methodology, the way the system worked, I think the number sort of missed and reporting to places that were not captured, I think was few and far between. But nevertheless, it was reports. But then within that, if we're talking about incidences, even that methodology was robust enough to dissect out the different incidences, particularly relating to the use of neuromuscular blockade. So even within a low incidence overall reported, we still were able to have that resolution power to dissect out different incidences within the overall incidence.
Sure.
And I think that was most marked by the caesarean section rate of 1 in 670 to no paralysis rate of 1 in 136,000. So we've quoted a wide range there.
Sure. But I'm reflecting on some of the discussions in the NAP5 panel, and actually comments I've heard from anaesthetists who have no connection with direct connection with NAP5, to the effect that the incidence of reporting seems to cast doubt or puts a question mark on the previous Bryce type study incidence.
I mean, clearly that was the danger of that, layer of interpretation, or you could say misinterpretation. And we did our best in the launch, in the production, you could say, of the report to avoid or prevent that. What it should have done is clearly stimulated further research for very large-scale studies doing the alternative method, which is a very large-scale Bryce methodology. And in fact, it is there are two recommendations within the report. One is to keep an ongoing registry of patients, however they are captured. And I think an ideal situation would be that, yes, you take the spontaneous report, put the patients into a registry, but then you have an ongoing Bryce activity that captures more and put them into a registry too. And then within your registry, it's sort of like the US registry, which is entirely passive and voluntary, but a more active registry, that then within it has two cohorts. You have a spontaneous cohort and a Bryce cohort, and actually you could track those over time. And that's embedded in the report as a as recommendation.